We are the Class 1C
Antiarrhythmics
Antiarrhythmics sisters. You heard it right. I am Class 1C Antiarrhythmics, and my generic names are flecainide and propafenone, and my drug names are Tambocor and Rithmol.
Drug classifications. I am therapeutically classified as antiarrhythmics and membrane-stabilizing agents. Pharmacologically, I am classified as sodium channel blockers and local anesthetics.
My mechanism of action is that I am the kind of drug that are strong blockers of sodium channels. Also, one of my two major drugs, the propafenone, has a mild beta-blocking effect as well. I have no effect on action potential duration, or APD, and effective refractory period, or ERP. The picture below shows the action potential of a patient on me.
Pharmacokinetics. If I will be administered through IM or intramuscular, I begin to act in the body between 5 to 10 minutes. I exert my maximum action between 5 to 10 minutes. My effects last long for 2 hours. If I will be administered intravenous or IV, I begin to act immediately, and my peak also immediately. I remain in effect between 10 to 20 minutes only. My half-life, or the time my plasma concentration reduced to half the original value, is 10 minutes, then 1.5 to 3 hours. I am metabolized in the liver and excreted in the form of urine.
These are my indications. I am used for atrial fibrillation treatment, or AF treatment, prevention of atrioventricular reciprocating tachycardia, or AVRT, maintenance of sinus rhythm and paroxysmal AF, and severe supraventricular tachycardia, or SVT.
Contraindications. I am contraindicated to people with post-myocardial infarction, patients with structural heart disease, patients who are hypersensitive to antiarrhythmics, significant coronary heart disease, and pregnant women that may be used only if the benefit outweighs the risk. I am also harmful to lactating women and children.
My side and adverse effects are as follows. For gastrointestinal, nausea or vomiting, and diarrhea. For systemic effect, headache, and dizziness. For the cardiovascular system, I can depress inotropy and increase risk of death.
Nursing responsibilities. Before administering, the nurse should assess aforementioned contraindications to prevent potential adverse effects, conduct physical assessment to establish baseline status, determine therapy effectivity, and to evaluate potential adverse effects, assess client's neurological status to determine potential CNS drug effects, assess cardiac status, the blood pressure, heart sounds, heart rate, and rhythm to determine whether change in drug dose is essential, monitoring of respiratory rate, rhythm, and depth to assess respiratory depression, monitor laboratory results, the complete blood count, renal and liver function tests to determine the need for drug dose changes and to identify toxic effects.
This is the nurse's responsibility during administering me. First, you have to monitor cardiac rhythm to detect potential adverse effects and evaluate drug effectiveness. Second, you have to provide comfort and safety measures to help the client tolerate my effects. Third, you have to ensure maintenance of emergency drugs and equipment at bedside table to promote prompt treatment in cases of severe toxicity. And lastly, you have to educate your client about my drug therapy.
After administering, the nurse should monitor client's response to therapy through cardiac output and rhythm, monitor for adverse effects, the sedation, respiratory depression, and the CNS effects. Evaluate the client's understanding on the drug therapy by asking the name of the drug, indications, and adverse effects to watch for, and monitor client's compliance to the drug therapy.
That is it! Now that you have known us, we hope that you have learned something from us. The Class 1C Antiarrhythmic Sisters. Till the next one, bye!
Hallelujah!